Morning. My name is Randall Oyer. I'm a medical oncologist. I'm the medical director of the Ann B. Barshinger Cancer Institute in Lancaster, Pennsylvania, which is part of the University of Pennsylvania Health System. It's my privilege to represent the Association of Community Cancer Centers as their representative to the National Cancer Policy Forum, and my pleasure to introduce and moderate session 2 of this workshop. Our session is entitled Strategies and Best Practices to Improve Communication Across the Cancer Care Continuum. We have a panel of 5 wonderful speakers who have experience in teaching, healthcare, research, and direct patient care in the 5 topics that will be talked about in our panel. We're talking about health literacy and how communication skills can support that. I will introduce each speaker before their talk, and then we'll gather as a panel at the end for questions and answers. Our first speaker this morning, talking about strategies for communicating about prevention and screening, is Kathy Mead, PhD, RN. Dr. Mead is a senior member of the Division of Population Science, Health Outcomes and Behavior at the Moffitt Cancer Center in Florida. Dr. Mead is a national leader in health literacy, health disparities, and communications. She was a member of the Institute of Medicine's Health Literacy Committee, which produced the 2004 report entitled Health Literacy, A Prescription to End Confusion. Dr. Mead has done some really interesting and important work with the Tampa Bay Community Cancer Network, which effectively addresses cancer prevention for colorectal screening, cervical cancer screening, and others. It's my pleasure to introduce and welcome Dr. Mead.
Okay, good morning, everyone. It is a pleasure to be here and to talk about cancer prevention. So today, I'd like to underscore the importance of cancer prevention communication for optimizing health benefits, highlight some of the opportunities that inform and create awareness and action towards preventive behaviors, illustrate some of those examples toward effective cancer prevention, and identify some policy recommendations for improved communication in cancer prevention. So we all know, right, that cancer prevention is key. In 2019, approximately 1.7 million people will be diagnosed with cancer in the United States. Of course, many more globally. Many cancer deaths, almost half and even more at some point, are linked to preventable causes, most significantly tobacco use, obesity, exposure to ultraviolet light, and vaccine-preventable infections with cancer. We know that healthy lifestyles can reduce one's risk and lower the risk of cancer recurrence and also improve treatment outcomes. Take a look at the puzzle. Look at your behaviors. Can you note any that you've done recently? We've been sitting for quite a while here in this room, and so I'm going to be out of the box and ask you to stand up for 20 seconds, a teachable moment, turn to your neighbor, and identify one of those areas that you think you're reducing your risk towards cancer. 30 seconds. Okay, 10 more seconds. Okay. Hopefully you've identified several of those pieces of the puzzle that might fit into you. But consider our patients and our families, and we're trying to fit all those different pieces of puzzle, and we're trying to deconstruct all of the information that goes in, trying to figure out what it really means to reduce our risk. So, of course, those are areas which has historically been termed, some of the passive ways to reduce our risk. But significantly, the promise of prevention, and there really was a very lovely article in 2018, which was the white paper for AACR by Lippman et al., that really talked about what has occurred in the last few decades in the area of prevention science. Advances in the understanding of cancer biology, molecular techniques that include next generation sequencing platforms and looking at new genomics landscape. Unprecedented opportunities to characterize what's going on at the cellular level to begin to look at pre-malignant progression, as well as great strides in those novel genomic biomarkers that are pointing us in the direction of personalized cancer detection. So in short, we have a variety of ways to really focus on cancer prevention. But that brings us to the World Health Organization, which again has long suggested that prevention offers a very cost-effective way and a long-term strategy for the control of cancer. But again, policies and programs, hopefully many of the policies that might be generated from our workshop today, might begin to bring additional awareness about what is needed to reduce cancer risk factors. But part and parcel to all of this is the needed information and support to really align with the messages relative to cancer prevention. Again, the American Association of Cancer Research not only is looking at prevention and cure, but also the importance of communication and collaboration to move this field forward. So in thinking about this, there are many opportunities, I believe, in cancer prevention. Most significantly, to keep the public and the community well informed about not only healthy lifestyles, as you noted in the puzzle, but also to convey some of the new cancer transformational topics that are being studied by many of our molecular biologists. But with that, and I think as has been pointed out by some of our previous speakers, we have a very diverse and changing demographic landscape here in the United States. And it's not just about conveying the message, but it's also looking at context. From where do people come from? What is their family like? What is their community like? So cancer prevention communications, I have been a long advocate for not only looking at literacy, but also the role of culture. Having heralded and developed a number of cancer culture and literacy workshops and institutions for a number of years. And combining that with a variety of intersectional perspectives, which can, again, add and inform and give context as well as to advance our thinking in the area of health equity. So in terms of communications and health literacy, we might say, well, what is prevention? What is risk reduction? What's chemoprevention? What is prevent carcinogenesis mean? And again, as we look at more personalized medicine, what is low, medium, and high risk? Which bucket do I fit in, and when do I need to move to action? And what does cancer interception mean? So when we begin to look at that, this is just a sampling of some of the words and terminology that patients may be exposed to. A number of years ago, to take the first term, what is cancer prevention? We were putting together a number of videos and brochures on the topic of breast and cervical cancer as well as prostate cancer. But when we created and carried out a number of focus groups, the term prevention was not widely understood. We know we want to get in there and do something before cancer happens. But as we started to talk, and this particular situation was a series of gentlemen from our Hispanic community, they said, so it's sort of like getting a checkup for your car. And we said, yes, bingo, that was the term. So again, being able to relate something that was common and that was acceptable and that was familiar really became what we included in our educational materials and messages. The same with the term cancer interception. A very lovely paper, which was a very seminal paper in 2011 by Dr. Elizabeth Blackburn, a Nobel laureate in the area of physiology and medicine, really put forth the notion of cancer interception, whereby we're trying to get at cancer at its very earliest pre-malignant stage. And she came up with the notion of looking at the football field of somebody who's intercepting a football. Now, that may not work, perhaps, in all cultures, but it is common in many that people may have a shared understanding. And that really is what we're trying to strive for, our shared understanding and shared meaning in these many often difficult conversations, and to try and convey cancer prevention, which for many of us is a little bit not as tangible as if someone has a diagnosis of cancer and they're looking at very specific and tangible treatments. So what can we do, and what are our communication opportunities? As I thought about this, I put them in three major categories: the 3D, the development, the delivery, and the distribution that may help to hone and focus some of our efforts and abilities. So when we begin to look at development, one of the most important points we need to think about is that a common thread across literacy tasks is that each usually has a purpose to read a food label and try and decipher, oh, how many calories is this? Is this something that fits into my daily allotment? To the ability to decide to get a vaccination for your children. Or how many fruits should you eat a day? Should I engage in smoking cigarettes, or maybe switch over to vaping because maybe it's not as harmful? And of course, in our cancer prevention transformation, how do we begin to define risk? Low, medium, and high as well. I would be remiss if I didn't make a mention of Len Leonard and Cece Doak, who, for those of you that have been in this field a significant amount of time, really were pioneers and forerunners in this particular field. Their book, Teaching Patients with Low Literacy, while it is out of print, is available in full text on the Harvard Health Literacy website. It really is a wonderful guide of being able to create and craft messages. And in talking, Len has passed, but in talking to Cece a few years back, she reinforced that the best communications are those that involve give and take. They should help people use the information in ways that are right for them and that are needed by them. And that message I also heard in some of our earlier speakers as well, is to really hone in on what do people really want to know and how can it help them in their situation. So about a couple years ago, I was trying to think about how we would create and develop messages, and came up with the mnemonic called REAL. REAL meaning relatable, making messages engaging, making messages actionable, and of course, literacy friendly. So we just published that in a chapter about a year ago. But coupled with that framework or underlying tenet of developing information must also be rigorous formative research. And this is just a sampling of ways to get to that point, which might include focus groups, in-depth interviews, think aloud procedures, a variety of pre-testing, learner verification, coupled by, and I've heard this message as well today, community advisors, community academic teams. And communities may be what we think of out in the community, but it might be a community of survivors. It might be a community of youth. We've had the Youth Ambassador Reaching Out program called YARO for a number of years, and the YAB guides that, the Youth advisory board. So whatever is appropriate for your setting and for the message, input and feedback is so valuable. Part of the process of rigorous formative research is that it's not always a one-time shot. It's systematic and it's iterative. And getting that feedback, infusing it into the messages, and then again, coming back with a better product. As part of development, drawing from communication theory, where one first thinks about, well, what is the task at hand? What's the behavior, say, vaccination? What are those strategic communications and engagement that are needed? What potential adoption, awareness, or decisions could result from that? And again, the last point, again, reiterated by our prior speakers, supported by access to high-quality services. Cancer prevention, especially as we look at some of the molecular advances, is only going to be beneficial if no one is left behind. I also like to draw from the work of Donald Nutbeam and others, which again, not only looks at literacy of communicating basic information, but trying to move individuals and groups to having conversations with providers and others, to being able to critically analyze and do something with the information. For example, much of my work is in the area of colorectal cancer. So what in the world is a fecal immunochemical test, FIT? When we first took this to some of our community members, they thought we were talking about an exercise program because get fit. And so while we were going to use that as a catchy title, it didn't seem quite appropriate to do that. And so we stopped in our tracks and we took a different tactic. So in short, we have this lovely little kit, which is a nice, tidy little envelope, which has all the necessary tools in it. But then we needed to deconstruct what does it mean to open it up, spread the tissue out, unscrew the cap, how much to, when does one go to the bathroom, where do you do it, how much do you dip in, because believe me, people have various amounts that they may think is the right amount. And coupled with a variety of information that we've created to support that, both in audio and in printed mode. But I will tell you, one of the best tools that we've had in our projects have been implemented out in federally qualified clinics is our little porta potty. These can be bought inexpensively at your neighborhood stores for probably $30, and we use that also as a teaching tool to actually demonstrate and show people what the process would be. If you're having this at a outreach event, don't leave it on the floor because the kids coming by may think it's a special place for them to go. But in short, deconstruction of information is looking at the task and step by step going through how you can support and inform individuals. As mentioned earlier, especially with Dr. Warta, look at the media. The media is a wonderful way to get information out and to communicate important information about cancer prevention. But again, don't forget about the pamphlet. This article came out recently, a couple years ago, in the Journal of Cancer Ed, which talked about the persistence of the pamphlet. Sometimes we've thrown away the written material, and I don't think we should. But we should balance it with a variety of information. Because information can influence, inform, inspire, persuade, but most importantly, to catch people's attention. And that's why the delivery mode, that second D, is so important. Why does good presentation matter? Because we want people to take a look at it and say, well, this is for me. I can do something with this information. Again, we had a project when we were creating a number of tools, educational tools on the topic of biobanking, which is a very difficult concept to convey, whereby individuals are providing their specimens for the future and for cancer prevention. Something as simple as what a cover might look like, and this was our first range of a cover. People thought that big freezer was actually a toilet lid. Do you see the theme that's running through here, these of literacy? The second cover that we presented to individuals, what do you think that looked like? That looked kind of like the mortuary. Our designer thought it was like a bank with a vault, but didn't go very far. While this really picked up the notion of looking at cells, people were very confused what that meant, which resulted in the final cover, which people liked because it showed people, it showed their community, and it was hope for a cancer cure. Again, while we can be fancy with the video, with applications, with text messaging, let's not forget what it might mean just to put something on a whiteboard. This was actually, I took this picture at one of our missions where we were, people were learning how to speak English. And so we were just writing a number of titles and thoughts about cough and stomachache and some of the products that people were using to do that. Our time is running, so I'll move quickly. As we have talked about today, do not forget the notion of information that's conveyed on one-on-one and to build that trustworthy information. And then that last D is distribution of how to get the messages out and reach marginalized populations. And again, this can be achieved through a variety of partnerships in your community. Our partnership is the Tampa Bay Community Cancer Network, and as you can see here, we have over 30 individuals who are partners, and we're expanding into other counties, and they really inform our research and our education. So with that, I'll end with 3 quick policy recommendations, one related to inclusion and access, to advocate at the national level for enhanced access, insurance coverage and reimbursements for cancer prevention, and risk assessments, whereby different national local groups can cross-talk and cross-walk to really embody those principles of culture and literacy for more inclusion. Second, in terms of research, to strengthen the evidence base of the role of health literacy, especially among marginalized, underrepresented, and underserved communities, whereby we can test a variety of communication platforms for those who may be socially isolated, and hope all the federal folks are listening to this. And then the last recommendation related to training is to advocate for the creation of a national council or network. And I heard a little bit of that early in some of our presentations, where we could begin to bring together policies and guidelines and useful tools, whereby the end result, we would have more individuals trained that can really deconstruct cancer prevention, which is really the future for all of us. So I leave you with the thought of we have many diverse populations in our country, and that cancer prevention can improve people's lives and contribute to well-being. And with that, I'll leave you with a pretty scene from Wisconsin. Thank you.